I had gotten pregnant and I had a miscarriage. And then my doctor told me later on that I have fibroids. And I'm like, fibroids? What's fibroids? What's that?
Uterine fibroids are benign tumors in the uterus that affect many, many women. About 30% of white women, about 80% of African American women, and Hispanic women are somewhere in the middle there. Asian women are the least commonly effective. Gynecologists are trained to do hysterectomy, and so the first and usually the only thing they think about is the treatment for fibroids is a hysterectomy. That's why 600,000 hysterectomies are done each year.
I didn't want a hysterectomy. That was on the table, but I didn't want that. So the alternative was a myomectomy.
Myomectomy means surgical removal of the fibroids. You don't take the uterus out, you just take the fibroids out of the uterus. You're really not going to hear about other treatment options unless you say, I am not going to have surgery, I refuse to have surgery.
I want women to know that they have a choice, that there's a choice that you don't have to spend 6 weeks of your life laid up in bed, that there's a choice that this could be something where if you still want to have children, you can have children. You don't have to have your uterus removed. There is another alternative that people need to know about.
UFE stands for uterine fibroid embolization. It's a way to treat fibroids in the uterus without surgery. The recovery period with UFE is usually around 1 week, and for the surgical procedures, it's around 4 to 6 weeks.
I found out about UFE at my job. Dr. Slonim and them came by the radio station. They asked me if I would interview her. And I'm thinking, oh boy, this is a great opportunity because I've got many questions about this procedure.
After talking to her, she kind of pulled me aside and said, listen, Dr. Slonim, I have fibroids and I don't know what to do about it. I've had a myomectomy already and there's still fibroids there and they're causing me more and more symptoms. And so in my mind, she's a perfect candidate to have the fibroid embolization procedure. The way we do the procedure is we go in through a blood vessel and feed a tiny tube to the blood vessels that supply the fibroids. Once the tube is in the right spot, we inject tiny particles that plug up the blood vessels that supply the fibroids, clogs up those blood vessels, it cuts off the blood supply, and the fibroids die and shrink and go away. There is no better procedure for treating all the fibroids than UFE.
I feel great. I'm back at work. I got in the car, drove, came here, went through the whole air shift, and I feel normal. I have no complaints. I have no pain. I feel like me.